patient. Tune in and see. Prepare with your health for you and me. Knowledge is power. We make it clear every Saturday morning.
Hey, good morning, everyone, and welcome to the UroPatient Podcast. I'm your host, Vic Senese. Glad to have you on board. Hey, checking us out for the first time, or maybe you've checked us out before and never liked and subscribed. What are you waiting for? Like and subscribe. Today, we're tackling one of the most confusing topics in prostate cancer, Gleason's 3+3 = 6. So if you've been told you have Gleason 6 prostate cancer, you might be wondering, do I really have cancer? Why do some experts say it behaves more like a low-risk condition while others still call it cancer? And most importantly, what does this diagnosis mean for your future? So grab a cup of coffee, sit back, and let's make sense of Gleason 3+3 together right here on UroPatient Podcast. So Gleason 3+3, often called Gleason 6, is the most confusing prostate cancer diagnosis that patients hear, because it includes the word cancer, yet behaves very differently from what most people expect. In this episode, I'm going to break down exactly what Gleason 6 means, why many experts are now considering it such a low risk and even non-aggressive form of prostate cancer that they may even try to rename it. Talk about how it's managed with active surveillance rather than immediate treatment in many cases. I'm also going to explain how pathology scoring works, what grade group 1 really means, and why understanding this diagnosis can help reduce fear and guide better decision making. So often hearing the word cancer can be life-changing, even when the diagnosis is low risk or highly treatable. For many patients, it immediately triggers fear, uncertainty, and thoughts about your mortality, which then can affect your sleep, your mood, the ability to process information more clearly. Some may feel overwhelmed and focus only on the word itself, rather than the specifics of the diagnosis, leading to anxiety or, this is important, rushed decisions about treatment. Don't need the rush. Others may experience stress that impacts relationships, daily routines, and overall quality of life. It's important to remember that not all cancers behave the same way, and understanding the details such as grade, stage, and risk level can help put the diagnosis in the proper perspective and guide more informed emotional decision making. Now, Gleason 3+3 cancer can sound alarming because of that number 6, but in modern medicine, it's actually the lowest grade of prostate cancer that is diagnosed. When doctors demystify the numbers, they are really explaining how the cancer looks under the microscope rather than how dangerous it is. So Gleason 6, also called grade group 1, means the cells look only slightly different from a normal prostate tissue and typically grow very slowly with very low risk of spreading. That's important. Because of this behavior, many men do not need immediate surgery or radiation and instead are safely managed with something called active surveillance. That means careful monitoring over time. Understanding what the number truly represents helps shift the focus from fear to facts, allowing you, the patient, to make calmer, more informed decisions about your care. At the molecular and biologic level, Gleason 3+3 = 6 prostate cancer, which is what we're talking about, generally considered low-grade tumor with limited genetic instability compared to higher-grade tumors. These cells tend to maintain many normal regulatory pathways that control their growth and division, which is why they usually grow slowly and often remain confined to the prostate for long periods. Large clinical and pathological studies show that true Gleason 6 disease, when accurately diagnosed on biopsy, has an extremely low likelihood of ever spreading, called metastasizing, because it lacks many of the molecular features associated with aggressive behavior, such as highly proliferative activity and invasive potential. That said, careful monitoring still is important because sampling limitations in a biopsy can occasionally miss higher grade areas nearby. Overall, the molecular profile Gleason 6 supports why it is often managed with active surveillance rather than immediate treatment. Now, there's an ongoing debate in medicine about whether Gleason 3+3 6 prostate cancer should even be called cancer at all, because its behavior is so different from what most people associate with the term cancer. Many experts have argued that the word cancer creates unnecessary fear for a condition that typically is very slow growing, unlikely to ever spread, and can be managed with active surveillance. As a result, some pathologists and clinicians have proposed renaming it to terms like indolent lesion of epithelial origin, or IDLE. Kind of reflects what it means. Better reflects that low risk nature and reduce overtreatment and anxiety. Now, still others caution that removing the label could lead to underestimating its importance or missing the rare cases where more aggressive disease is nearby. The debate continues, but it reflects a broader effort in medicine to balance accurate labeling with clear communication that mostly is done to make it easier for patients to make informed, less fear-driven decisions. That's the key word. Don't make your decision based on fear. The main concern with overtreating Gleason 3+3 cancer is that treatments can cause more harm than the disease itself. Let that sink in. Because this low-grade cancer usually grows so slow and often never spread, aggressive treatments like surgery or radiation may not improve your life expectancy, but can still lead to significant side effects, such as urinary incontinence, leakage of urine, erectile dysfunction, bowel changes, and other long-term quality of life impacts. Let that sink in. You might just say, well, why not just get rid of it with surgery? Because you may not need the surgery. It may never impact your life, but those changes from surgery or radiation can affect your life forever. So overtreatment can also cause emotional and financial stress, along with recovery time and potential complications from procedures that may not have been necessary. For these reasons, many men with Gleason 6 disease are safely managed with active surveillance, which helps avoid or delay treatment unless the cancers show signs of becoming more aggressive. So the new treatment paradigm for Gleason 6 prostate cancer has shifted significantly over the past couple decades, moving away from that go right into immediate intervention towards a more conservative, individualized approach. In the past, most men diagnosed with prostate cancer were offered two options: surgery, cut it out; radiation, burn it out. Largely because all prostate cancers were treated as potentially life-threatening. Now, today, we better understand the tumor biology and long-term outcomes that have shown that Gleason 6 disease is usually so slow growing and unlikely to ever spread, that leading to widespread adaptation of active surveillance as a preferred first-line therapy. This means careful monitoring with PSA tests, imaging studies, and repeat biopsies rather than immediate treatment, reserving intervention only if there are signs of progression. This shift reflects a broader focus in medicine on balancing effective cancer control with preserving quality of life and avoiding unnecessary treatment harm. Men who are often considered ideal candidates for active surveillance with Gleason 6 prostate cancer typically have features that suggest very low risk, slow-growing disease, as we mentioned. So now this includes things like the low PSA levels and the amount of cancer found on biopsy, meaning low volume. Cancer confined to a limited number of biopsy cores. No concerning findings on MRI, such as visible extension outside of the prostate. Pathology confirming grade group 1, true Gleason 6 only, without any higher grade component, is also essential. In addition, patients who are comfortable with regular follow-up testing, such as PSA monitoring, periodic MRI scans, and occasional repeat biopsies, tend to do well on surveillance. Overall, the goal is to safely monitor the cancer closely while avoiding or delaying treatment unless there are signs that the disease is changing if the disease is changing in behavior. So, active surveillance for Gleason 6 prostate cancer follows a structured monitoring cycle designed to watch the cancer closely while avoiding or delaying treatment unless it becomes necessary. After your initial diagnosis, we're going to follow blood tests, the PSA blood test. PSA blood test prostate MRI and sometimes another biopsy are the best way to follow this. Now, PSA typically checked every 3 to 6 months. We don't want it to suddenly start jumping up. And periodic visits to your clinic. So it doesn't mean you're off the hook. You still got to come in and see us. Repeat imaging with the MRI and follow-up biopsies are done at set intervals, or if there's changes in the PSA or other concerns. The purpose of this cycle is to detect any early signs of progression from low-risk disease to more aggressive patterns, giving you guys the safety of close observation. For many men, this approach provides peace of mind by actively managing the condition without side effects of immediate treatment. So what's the role of some of this new technology like MRI? Well, MRI and genomic testing play an important role in helping doctors better understand what a Gleason 6 is and personalize your treatment. Multiparametric MRI, that's the fancy name for this, allows clinicians to visualize the prostate in detail and identify any areas that may look more suspicious than standard biopsy samples, helping confirm whether the cancer is truly low risk or are there some hidden higher grade areas. Genomic testing, on the other hand, analyzes the activity of genes within the tumor to estimate how aggressive the cancer is likely to behave over time. Put these two together, and you have an extra layer of precision beyond traditional PSA and biopsy results, helping confirm who a good candidate for active surveillance is and who may not be. So if you're on active surveillance for Gleason 6 prostate cancer, a shift to active treatment is considered only when there are clear signs that the cancer is changing in behavior or risk. This may include, as we mentioned, a rise of PSA over time that suggests increased activity, new or worsening findings on an MRI, or a repeat biopsy showing a higher Gleason score, like a Gleason 3+4, that's a 7, which indicates more aggressive disease. Doctors also consider factors like increasing cancer volume in biopsy cores, or evidence that cancer is extending beyond its original area. Sometimes the decision is influenced by patient preference or anxiety about ongoing monitoring. The goal is not to rush into treatment, ever, but to intervene at the earliest sign that the cancer is no longer truly low risk, ensuring effective control while still protecting quality of life whenever possible. A lot of patients wonder, by delaying treatment and waiting till it starts to progress, have I lost my goal or my time that I could been cured, the opportunity to cure it? No. As long as it's a low grade and we're watching it, your opportunity to still cure this will be just as good. Now, for many men with Gleason 6 prostate cancer, the biggest difference between active surveillance and immediate treatment is quality of life. Hey, quality of life matters, folks. Active surveillance allows patients to maintain normal urinary, sexual, and bowel function because there's no surgery or radiation performed unless the cancer shows signs of progression. In contrast, treatments such as prostatectomy, removal of the whole prostate, or radiation can be very effective in controlling the cancer, but come with a catch: long-lasting side effects, including, for some men, urinary leakage, erectile dysfunction, fatigue, bowel irritation. While treatment can provide peace of mind for some, it also carries physical recovery time. Remember, you got to recover from an operation or from radiation. Active surveillance focuses on preserving that quality of life while still closely monitoring the cancer for any meaningful changes and offering a balance between safety and living well. So Gleason 6 prostate cancer, often better understood, is a condition that can be managed carefully over time rather than a crisis that requires immediate aggressive treatment. In most cases, it behaves in a slow, predictable way. That's key. We've got a lot of years of watching this stuff, allowing doctors and patients to safely monitor it through active surveillance instead of rushing into surgery or radiation. This approach recognizes that the main priority is not to fight urgently, but to track the disease closely and intervene only if it shows signs of becoming more active. Framing it as a managed condition helps reduce fear, supports clear decision-making, and allows many men to preserve their quality of life while staying safely under medical supervision. So before making decisions about a Gleason 6 prostate cancer, it can be helpful to go into your appointment with a clear checklist of questions for your doctor. You may want to ask, is my cancer truly grade group 1? And how confident are you in that diagnosis? What is my PSA level, my PSA density? How does that affect my risk? How much cancer was found on my biopsy? And were any higher grade areas seen or suspected? Do I need an MRI or genomic test to better understand my risk? Am I a good candidate for active surveillance? And what would my monitoring schedule look like? What signs would trigger a need for treatment in my case? And finally, what are the expected side effects and quality of life differences between surveillance and treatment options? Having these questions prepared helps ensure a clear, informed discussion and supports shared decision making. I always think it's best if you go in there with a piece of paper with the information you want to ask, because you're going to get nervous and you're going to forget what to ask. All right, let's wrap it up here. Gleason's 3+3 or Gleason 6 prostate cancer is often a diagnosis that brings more fear than it needs from its name than its actual behavior. And understanding the facts makes a significant difference in how it's approached. For most men, this is a low-risk condition that grows slowly and can be safely monitored over time with active surveillance rather than requiring immediate treatment. The key is, however, if you're not somebody who's going to follow up, this isn't for you. You have to be able to have good, clear follow-up, good communication with your doctor and his office. Make sure that you're getting all these tools to follow it, like the PSA, the MRI, genomic testing. Important. So now, while the word cancer is understandably scary, I get it, many patients with Gleason 6 disease can live a full, normal life without ever needing intervention. We always say that you die with your cancer, not from your cancer. That's key. The goal is to balance safety with quality of life, making decisions based on evidence rather than fear.
From research updates to daily advice, Vic explains it all simple and precise. No question too small, no topic too wide. We're your urology partner, right by your side. Uro patient, tune in and see, paving your health for you and me. Knowledge is power. We make it clear every Saturday morning. The podcast is here.